Okay, now let's go to types of disabilities. Intellectual disabilities. We are going to be starting from intellectual disabilities. What are intellectual disabilities? Intellectual disabilities are characterized by significant limitations in intellectual functioning, cognition, understanding concepts, and adapting to behavior. These limitations affect concepts, understanding concepts, social and practical skills, which are critical for daily life and learning. These are the type of children you continue to teach them how to put on their shoes the right way till they are 10 years. They still don't understand that this is left and this is right. Every time they put on banana shoes, they are intellectually disabled. These are the type of children you will teach the concepts of numbers or number ordering for 2 years. They can't get it. It is intellectual disability. These are the type of children you will teach to say good morning every day. It is so unfortunate that teachers beat this type of children, claiming that they are stubborn. Inexperienced teachers, I mean. Some of them are not stubborn. It is intellectual disability. They can't remember. There's nothing you can do. When it has to do with memory, there's nothing you can do. It's not there, it's not there. So you have to just keep telling them, keep practicing it. So intellectual disability is one. And intellectual disability can actually disturb activities of daily living. They will always forget. They can forget how to hold a spoon or a knife or a fork, any eating utensil. They can stand up from their seat and go outside, and when they come back, they can't remember their seat. These are some of the children that always fight over other people's seats every time they are in class, and you feel they are stubborn. They don't hear word. They like sitting, using other people's things. No, it is intellectual disability. But when you don't know how to correct them the right way, you start hitting them, you start beating them in the course of correcting them, you will now create another problem. And the problem you'll be creating is that the child will feel you hate him or her. Whether you are the teacher, whether you are the parent, whether you are the caregiver, whether you are the therapist. Remember, no matter what the disability of a child is, they understand pain, they understand abuse. So if you stand as their abuser, in the course of you saying you are correcting them, they are going to be avoiding you. They are going to be avoiding you because that is not the way to correct them. Now, what are the causes of intellectual disability? Genetic conditions. Examples include Down syndrome and Fragile X syndrome. Now, Down syndrome is like what I was saying at the beginning, that there are some disabilities you will not see in our environment often. Down syndrome is common here. Those children that their faces are flat and all of them look like they are from the same parents. If you get to a school, you see 7 of them, the whole 7 of them, you will think they are from the same parents. They are not from the same parents. It is the sickness, it is the disability that has a face. Down syndrome is the only disability that has a face. It has a shape, it has a face for children. So once you know this is Down syndrome. Even as a 1 day old baby, if you see a Down syndrome, as a specialist, you should know it. I will send some of these facial looks after this class to the groups. Now, another cause is prenatal or perinatal, before and after birth. Before and after birth factors. Exposure to harmful substances. Maybe parents, maybe both or either of the parents are on hard drugs. Maybe they abuse drugs, they abuse alcohol, during pregnancy. They have serious infections they did not treat. It could cause birth complications, and insufficient prenatal care could lead to Down syndrome or Frege X syndrome. Another reason is environmental influences. Factors such as malnutrition during pregnancy or after birth, limited early stimulation, and socio-economic challenges can contribute to a child having this disability, particularly in contexts where resources are scarce, like Africa, like some Asian countries, where medical facilities are far from pregnant women. Health centers, antenatal centers are far from pregnant women. This could be a cause. Signs and symptoms: delayed language and cognitive development. Delayed language and cognitive development. Difficulties with reasoning. They can't reason. The memory bank is very small. Problem solving skills are not there, and they don't easily adapt to their environment because they don't easily understand their environment. Now, challenges in social interaction. They don't talk in time. They have problems with language development and self-care. They could be 12 and they still cannot take their birth on their own. In the Nigerian context, challenges such as limited access to early diagnostic services may mean that signs go unrecognized. Now, in the developed world, science and medical research are so developed to the extent that even while a woman is still pregnant, they can detect, MRI scan can detect a child that is coming with Down syndrome, detect a child that is coming with autism spectrum disorder, can detect a child that is coming with a lot of disorders, and they could give medical advice to some parents that maybe they should abort that child because it's coming with a lot of deformities. And this has been saving a lot of young parents problem. Instead of bringing to the world a child that will give you problem and will not even enjoy staying in the world, they can get rid of it. We have not got to that point in Nigeria, but I hope we'll get there someday. Now, what are the early intervention for intellectual disability? Number one, screening and assessment. Routine developmental and cognitive screening to detect delays. Early intervention will only work when these things have been discovered early. Number two, individualized educational plans. After discovery, the next thing is IEP, individualized educational plan. After assessment, tailored educational plan that we focus on developing practical and academic skills. That is, if the child can cope with academic skills. Some of them cannot cope with academic skills. They can just cope with activities of daily living and skills that they can use to manage their life. Family and community support, providing education and information, enough education, information and resources to parents and caregivers to support learning and managing these children at home is very, very critical. Now, inclusive management for intellectual disability, differentiated instruction, adapting teaching methods and materials to match individual learning needs. Adapting teaching methods and materials to match individual learning needs, because they can't learn like every other children. They cannot learn like every other children. They must have one-on-one education. Assistive technology, utilizing tools such as visual aids and interactive software to support learning. For example, for ASD, autism spectrum disorder, there are some musical innovations that medical science and therapy has discovered that has been helping children with autism spectrum disorder in foreign countries. I've not seen it here, but they've started using it in foreign countries. There is also HBOT technology of giving them enough oxygen treatments that they've started introducing in some Asian countries to help them. Although this is still a research in progress, but they have started using it. And diagnosis is 50-50. Some children can react badly to it, and some children can be helped. These are the new technologies that has been coming up. Now, collaborative learning, encouraging peer support and group activities that promote social interaction, because one of the skills they lack is social skills. They lack social skills. So social interaction is very, very important. Teachers training, ongoing professional development in special education, and inclusive strategies is vital for effectively supporting these students. Teachers must be in the know. If you are a teacher and you don't know, there's going to be a lot of problem. I'm saying I'm from Bangladesh. Look at the messages. Strangers are entering that. Okay. Now, the second type of disability we want to talk about is autism spectrum disorder. Autism spectrum disorder, ASD. Now, what is ASD? ASD is a developmental disorder affecting communication. They lack communication skills, behavior, and social interaction. There is always, now, why do children with ASD have behavioral problem? They have behavioral problem because they cannot express their emotions and their feelings. When you are feeling uncomfortable, or you have a need, or you feel like saying something and you cannot express it, you don't have words to express it, you're going to behave. Maybe somebody is trying to force you to do something and you don't want to do it, and you don't know how to say, stop, I don't want to do this thing. It is either you fight that person or you throw that thing away, and that is where behavior comes from. Behavior comes from lack of communication. If people can communicate more, we will have less of behavioral management problems. That is why it is important for every special needs teacher to know about ABA, adaptive behavioral analysis, for teachers to know about ABA, so that you know how to manage behavior. Because you have somebody with you who cannot talk, and when somebody cannot express himself, you must understand behavior. Every behavior has a meaning and has a reason. Every behavior has a meaning. So one of these practical skills teachers should have is the ability to understand behavior, not assume, not believe that because Dele behaved like that yesterday and Peter is behaving like that today, that means Peter is stubborn the way Dele is stubborn. No. Dele might be stubborn, Peter might be going through another reason why he's showing that behavior. So behavior must be understood, and every behavior has a meaning and a reason behind it. So before you provide a solution or assume that a child is doing something, you must find out the reason behind the behavior. You must find out the reason behind behavior. Now, ASD can go ranges from mild to severe. That autism spectrum disorder ranges from mild average to severe. You could have a very severe case, and you could have a mild case. So you have to know, is this mild, is this severe? The level of the disability in the child will determine your intervention. There are so many children in regular schools, in mainstream schools, that have mild disabilities. They can be managed in that school. They can cohabit with regular children. But there are some children who have very severe issues that making them to cohabit with regular children can cause another problem for other children. They can even be harmful to regular children, and they will not be learning anything themselves, because they can only thrive in an environment where they are given individualized attention. What are the causes of ASD? Genetic factors. Let me quickly tell you that 75% of these disabilities have genetic undertones. That is from parents. A predisposition to ASD may be inherited. If a child has two parents that are ADHD, they are hyper, two parents that are hyper in activity, the chances that they can have a child with ASD is very, very slim. Is very, very high. Chances that they can have a child with ASD or extreme ADHD is very high. If the father is an hyper and the mother is also on the hyper level, the possibility of them having this type of children is very, very high. Now, environmental factors. Certain prenatal and perinatal conditions may contribute to ASD, although the exact causes of autism spectrum disorders have not fully been understood by medical science. Research is still going on the major causative factor of autism spectrum disorder. Signs and symptoms of autism spectrum disorder. Difficulty with social interactions and understanding social cues. They have difficulty with social interaction because the first problem they have is communication. And their brain works differently. They are wired differently. And they have sensory issues. This t-shirt I'm putting on, somebody with ASD, a child with ASD might not be able to wear it. Maybe it's going to be providing some heat, some type of texture, sensory issues on his or her skin. So, interactions and understanding social cues become a problem. When you want them to go and play ball, they are fixated on a picture and they want to continue to stare at that picture for as long as it will satisfy their mind. They are also prone to orderliness. Everything must be in the same order every day. Where they put their bags every day must not change. If it changes, there's going to be a meltdown, there's going to be a tantrum, there's going to be crying, because they don't understand social cues and their life thrives on routine. They are not people that you can change the things they do randomly. You are going to have a problem with them. Now, another factor is delayed or atypical language development. Most children with autism spectrum disorder have delay in language, or they speak in a typical way. Some of them are even totally non-verbal. They don't talk, or they speak in monosyllables or echolalia. They only repeat the things you say. They can't form words by themselves. They have repetitive behaviors and a strong need for routine. Repetitive behavior. A child with ASD can eat rice from January to December. And this is where some of their problem comes, because their rigid nutritional lifestyle could be working at a disadvantage to their genetic makeup. Now, a lot of children with ASD have comorbidity with ADHD. Now, if a child is lucky, there's nothing like ADHD during observation or assessment. It is just ASD. Children with ASD are really hyperactive. In fact, they are rigid. They want to be on the same spot. Or if they are going through a certain area, they will. But when you begin to see hyperactivity, there's a comorbidity coming somewhere. There are traces of ADHD with ASD coming together. And as professionals, you need to understand that these two are present. Now, if a child has ADHD and that child is based on some nutritional foods or drinks that has a lot of carbohydrates, a lot of sugar, a lot of iron, or some type of supplements, that condition is going to be getting worse. It's not going to get better. That is why some of us are now using the nutritional method to solve this problem, in addition to medical intervention, because some of them could be so severe that they have to have psychiatrists or neurologists work with them. Sensory sensitivities such as overreaction to sounds or textures. Early intervention, early diagnosis, developmental screenings to identify signs as early as possible. Therapeutic interventions, they need the assistance of speech therapists, occupational therapists, and behavioral intervention like applied behavior analysis that I mentioned earlier, ABA, to work with them. Family engagement, training parents to support consistent strategies at home. Parents of this type of children must work together with the school to get a solution. If you come across parents who have children with ADHD and ASD and they are not ready to cooperate with the school, it is better not to work with such parents. It is better not to register such children, because the school is going to have a problem. Inclusive management. How do we manage these children? Structured routines with clear visual schedules. Structured routines with clear visual schedules. You have to be able to use a lot of visual props with them. Pictures printed out. Objects showing them. Do you want to drink water? You want to sleep? Do you want to sit down? You have to be able to use a lot of pictures and props to work with them. Sensory-friendly classroom modifications. If you are admitting them in an inclusive school environment where you have other children that are regular children, every child in that environment must understand this inclusive child. They must understand that there is this type of child in our midst, and they must be able to join hands with the teacher to show empathy to that child, to understand their disabilities, and not be surprised or alarmed by their reactions or meltdown occasionally. There must be collaboration with specialists and targeted professional development for educators. Any school that has this type of children must also invest in training and educating every staff of that school. I've heard stories of schools where children with this type of disabilities ran away from school, escaped from the school compound, because the gate man, the security man, was not educated. He didn't know that the child has a problem, and it became a big problem before they could discover the missing child. Now, the last one we are going to be taking for this evening is cerebral palsy, CP, cerebral palsy. What is cerebral palsy? Cerebral palsy refers to a group of neurological disorders that affect movements muscle tone, and posture due to early brain damage. Most children with cerebral palsy have problems right from when they were in their mother's womb or immediately after being born. Infection, untreated infection from the mother, or lack of good medical intervention. There are a lot of women who don't go for, they never attend antenatal till they will give birth. So there are problems in the making. Causes, prenatal factors, infections or developmental abnormalities before birth. Infections during pregnancy could lead to cerebral palsy. Perinatal factors, complications during birth, such as oxygen deprivation, delayed labor, mismanaged labor and delivery. Postnatal factors, early head injuries or infections. What are the signs and symptoms? Muscle stiffness and flaccidity, coordination issues and balance problems, challenges with fine motor skills. In some cases, seizures or other developmental delays may be present. What are the early interventions? Therapy, early initiation of physical, occupational, and speech therapy. Medical management, medical and regular assessment to monitor progress. Parental support, education, and counseling to help families navigate care options. Inclusive management, classroom modifications, that is adapted seating, assistive devices, wheelchairs, special chairs for CP children, integration of therapy recommendations into daily classroom routines, flexible schedules and physical education adjustments. That is where we're going to be stopping this evening. It's 7 o'clock. That's where we're going to be stopping this evening. And we are going to be continuing from here tomorrow in class. Thank you for attending this class. If you have questions or contributions, you can drop it under this post. I appreciate every one of you that have sent a message because of my health. I hope you'll be able to manage my voice this evening. I'm still recuperating. Thank you very much. Good evening. Mr. Lighton. Mr. Lighton. Báwo lára Bangladesh